Hello everyone, my name is Dr. Kenneth Uben, and in this video I'll be talking about a emerging zoonotic disease known as anthrax. This disease is zoonotic in the sense that it can affect both humans and animals. It is caused by the bacterium Bacillus anthracis. It is most common in herbivores. Clinical manifestation you see with this disease is acute septicemia and hemorrhagic lymphadenitis. It's commonly known that this disease has an ability to cause hemorrhages from all orifices, so that is one of the pathognomonic signs you see with this disease. It is a spore-forming bacterium, and that enables it to be viable in the soil for so many years. It can also be transmitted by biting flies, and as veterinarians it is our job to be the first line of defense, protecting livestock, animals and humans by vaccinating each and every livestock animal in the state. We're able to vaccinate about 1 million animals, including cattle, sheep and goats, and this in turn is a means of prevention to anthrax in animals as well as in humans. The mode by which this bacterium causes disease is by the action of its lethal toxins and edema toxins, causing local necrosis and extensive edema of disseminated tissue destruction and organ failure. So even in veterinary medicine, we discourage necropsy when this disease is suspected. It is reported in almost every continent, and then it is most common in agricultural regions, neutral to alkaline calcareous soils. Have clinical forms to this disease. The cutaneous form, 95% of all cases reported have been said to be the cutaneous form. They have the gastrointestinal form, which includes the laryngeal form, and then inhalation and injection. Anthrax. Keynote: this disease is the category A highest priority by the Center for Disease Diagnosis list. It has been used as a biological warfare in 2001. 5 deaths were recorded with 22 diseases via mail. It is very deadly that the World Health Organization estimates that 50 kg of this bacterium is released in a population of 500,000 people. 95,000 people will die, and then 125,000 will be hospitalized. The effect is actually higher in animals, and then the incubation period for this disease ranges from 3 to 7 days. The clinical findings for anthrax in animals is usually paracute to chronic. The paracute is usually very rapid in trembling, dyspnea, and then death. The acute is sudden onset of fever, lethargy, stupor, respiratory and cardiac distress, and then death with a temperature of 41.5. The postmortem lesions you see with this disease is rigor mortis is actually absent, where you have stiffening of the dead carcass. This disease, there is no rigor mortis. The animal remains soft, and then there's this dark blood that oozes from the mouth, nostrils and nose, usually with bloating and then rapid body decomposition. The blood is tarry, thickened and fails to clot. Hemorrhage, edema and necrosis is also seen. Diagnosis for anthrax in animals: clinical examination and then laboratory examination. Just take swab through the nasal cavity of the suspected animal, allow dry, and then the results of the sporulation is seen in the lab. Differential diagnosis: there are numerous differentials to this disease: Clostridium, bloat, lightning strike, acute leptospirosis, anaplasmosis, bacillary hemoglobinuria, poisoning with barking fence, sweet clover, acute infectious anemia, purpurea, colic, lead poisoning, acute classical swine fever, African swine fever, pharyngeal malignant edema. The best way to control this disease is by vaccinating your livestock animals against anthrax. From 3 to 6 months of age, your animals are due for the vaccine, and then an annual booster is given. Treatment for this disease, if it comes to your farm, it's by use of broad spectrum antibiotics to control the disease. Please ensure you boil your meat properly. Keynotes: only buy veterinary certified wholesome meat from veterinary inspected abattoirs and meat control posts to prevent coming in contact with this disease. If there is an outbreak of this disease in your area, in your city, in your farm, contact the nearest veterinary officer or the nearest veterinary control post and ensure that the meat is properly disposed. Thank you for listening. Until next time, I remain your best doctor, Dr. Kenneth Owen.